Hello, everyone. I am Professor Tarassenko, and I'm chairing a roundtable on the Topol 2 years on. If you, as I'm sure most of you remember, in February 2019, Health Education England published the Topol Review. It had brought together experts in digital healthcare development, and it was presented to the Secretary of State, Matt Hancock, providing key recommendations and detailed descriptions of the elements for change needed to develop a generally effective and efficient digital-ready 21st century healthcare workforce. Of course, when the report was published, no one could have foreseen the world-changing impact of the global pandemic on all elements of life, not least that of healthcare. And so what we're going to be doing today is to reflect on the original publication and its findings. And for that purpose, we've gathered together here around this table, this virtual table, the authors of the Topol Review, so that they can discuss key findings 2 years on, and in particular consider where digital healthcare has benefited the response to the pandemic, and where in fact implementation may have been delayed as a result of having to prioritize service delivery for COVID-19. So I would now like the panelists to introduce themselves, and we'll start with Professor Bennie Ferry.
Hello, hi, my name is Bennie Ferry. I am the National Dean for Healthcare Science and Health Education England and head of the National School of Healthcare Science. And on the Topol Review, I was involved in the chapter in organisational development, but we also at the school deliver lots of the geneticists for the whole of the system.
Hi, I'm Rose Luckin. I'm a professor at University College London. I have a background in artificial intelligence and education, and I worked with the robotics and AI group of the Topol report, and also worked with the education recommendations and chapter in the report. Thank you.
Thank you very much, Rose. Now Elizabeth.
I'm Elizabeth Manero, and I was a member of the Health Education England Patients Forum, and I was the patient representative on the Topol Review Board and led the subgroup of other patient representatives. I think we looked across all issues in the review, really, and focused in particular on the health inequalities and digital inequalities side of it.
Thank you very much. Now Dr. Harpreet Sood.
Thank you. I'm Dr. Harpreet Sood, a GP in the NHS and currently a board member at Health Education England. I worked on the Topol Review on the AI chapter, but also the digital medicine section.
Thank you very much. Henrietta.
Hi, I'm Henrietta Biobankes, and I'm currently the head of blended learning and the lead for digital literacy at Health Education England. And on the Topol Review, I worked as the project lead, but with a particular interest and focus on the health inequalities section with Elizabeth and others.
Thank you very much, Henrietta. Patrick.
Hello everyone, I'm Patrick Mitchell. I'm the Director of Innovation and Transformation in Digital at Health Education England, and I was the Senior Responsible Officer working with Eric Topol on the report.
Thank you very much, everybody. So just to say, Professor Lionel Tarassenko, as I've already said, I'm Professor of Electrical Engineering at the University of Oxford, but I set up the Institute of Biomedical Engineering just over a decade ago, and I've also been involved with a couple of companies where I'm a director, and over the past 12 months, really, both with my research group and with those two companies, I have been very much involved with some of the technologies that we had a look at in the digital medicine panel. So remote monitoring, wearables, etc. Developing those technologies to help mitigate some of the effects of COVID-19. So Now that we've met everybody, I'm going to ask Patrick and Henrietta to give us a quick summary of progress that's been made in the last 12 months, so that we know where we are at the moment, and we can then discuss some other aspects of the technologies covered in the original report and their impact on the workforce.
Thanks, Lionel. I'll just give a very quick overview, but the over 60 recommendations from the Topol report have all been incorporated into programmes within Health Education England, supporting workforce development. Most of them sit with our digital readiness programme, which is a joint programme with NHSX, and covers a number of points. The first is around board development, and we've had over 22 boards so far undertake a board in a day development session, which was one of the key recommendations from the Topol report. A further 40 have signed up for this digital programme, which takes boards through an understanding of agile transformation and the use of digital, and helping them think through the infrastructure they need to put in place to really bring to light the recommendations of the Topol report, and for their own organisations, what does digital transformation mean for them? The second component is about the professionalisation of the digital workforce, from data analytics, informaticians through to AI specialists. And we're working with six professional bodies to bring together this workforce to align standards by which education and training can take place for these individuals, but also to help them think about career pathways within the NHS and care sector. And we've established the Federation of Information Professionals to support this work, bringing together those professional bodies. We have a separate programme looking at workforce planning for the digital workforce that's required in terms of what we might need over the next decade. Currently, we've got over 40,000 people working in the NHS in this space, and certainly the Topol report suggested we'd probably need at least 70,000, and looking at the latest workforce planning we've done, I think that's a minimum based on our current findings. We're doing work through the digital leadership space, looking at how do we build an infrastructure of individuals that really understand what digital's about and has the leadership capacity and abilities and capabilities to take this agenda forward. Over 300 people now have participated through the Digital Academy, and we're just recruiting the next cohort for next year. And even with COVID, we've been managed to keep that going through the virtual space. We've got a whole section looking at the care sector and the particular needs of the care sector on digital. And we've got a whole section on digital literacy, which Henrietta will speak about at the moment. HE is also looking at health and digital literacy together, and our librarian service is working with the Chartered Institute of Librarians and our Patient Advisory Forum to look at how we can bring digital skills to patients and citizens. We've got a group looking at AI and digital medicine and its impact on education and training, working with the colleges and the regulators. And we've got a separate group now working with the two surgical Royal Colleges of the UK, looking at the impact of robotics and training for surgeons in robotics. I'll now hand over to Henrietta, who will just give you a very quick update on the digital literacy section.
Thanks, Patrick. So rather comprehensive in terms of what we're doing to develop a digitally ready workforce, specifically around the digital literacy development. It's very much taking a number of approaches, as one size doesn't fit all, and looking at how we develop the digital literacies of the generic workforce, not just our clinicians, but the non-clinical workforce as well. Looking at it from an approach of an undergraduate perspective, how do we begin to incorporate this into undergraduate curricula is really key. And on the basis that digital literacy skills can sometimes be context specific, we are looking at how this has implications for specific professions, but also service areas, which we have recently seen through the COVID. And then looking at championship, whilst we acknowledge that there are digital literacy skills capabilities within the system, it is varied, and there are instances where people need a bit of hand-holding. So looking at championship models as a way of bringing people or getting them engaged with the literacy skills. Of course, the so what is always very important. So how do we ensure that there are adequate and highly assured resources available for colleagues to be able to develop their literacy skills where gaps have been identified. But more importantly, because we are such a busy workforce, thinking about how we can intelligently signpost people to this existing resources or repository of resources that exist. I think whilst we're doing all of that, it has been very well highlighted through the COVID as well, that we need to actively start thinking about the approaches to actually training our health professional workforce. And obviously we've started doing that through introducing a fully integrated blended learning approach to our pre-registration program in nursing, and fastly advancing this into other areas of health professional training. So I think, yeah, that's where we are at, and lots more to be done. So I'll just hand over to Bernie, who will be talking to us a bit more about the genomics program.
Hi. So from the genomics program, there were three main groups of recommendations. One was around health systems, and one was around healthcare professionals, and the last was around citizen and the patient. And a lot of work has been done since then around the health systems, not just within HEE, but just in general. There's been a very, partly coming out of the Topol Review, there's now a new Genomics UK report. And in that, what's happened since the Topol is that there's now the genomic medicine service is now it's been procured, and it's now known as the Genomic Medicine Service Alliance. And out of that, there's part of that is the National Genomics Informatics Service and a network of national genomic laboratory hubs. In addition to that, under the service, there's a National Clinical Reference Group and the National Genomic Test Directory. So that's kind of the international framework of how all of the genomic developments are beginning to, they're going to fit under that. The second thing to say about the recommendations that are under the healthcare professionals. And one of the first recommendations was that all healthcare professionals should receive core training in genomic literacy. And we've done quite a lot on this now in the past 2 years. So for instance, in the pharmacy world, the Royal College of Pharmacists is involved and is actually looking to make sure that there are, or to ensure that there are genomic programs and modules in all of the undergraduate pharmacy. We are speaking with the national nurses council to be able to introduce genomics into all nursing undergraduates. And we've got steering groups set up, and we've got special interest groups set up, and this is work that's ongoing now. Also coming under part of the National Diagnostic Programme. And since the Topol Review, we have increased the numbers of genomic scientists on the STP and HSST. We've increased enormously the numbers of genomic counsellors. We've introduced the molecular pathology of both molecular pathology of acquired disease and molecular pathology of infectious, which is actually very interesting, and we could talk about that later as how that pertains to COVID. We have introduced a new STP in cancer genomics. It's very interesting that the biochemistry scientists, there's a lot more, the whole core curriculum for that and the specialist curriculum for that has changed. And it now includes lots of modules on genomics. It's the same with microbiology. And actually, it's also very similar in reproductive sciences, because the reproductive sciences are also key to kind of prenatal diagnosis of all sorts of different diseases. And I think lastly, there's been a big increase in genetics and genetic modules now in histopathology training as well. I think the last thing I'll say in terms of the citizen and the patients, there are primary care groups being set up with GPs to try to understand how patients can interact with their GPs and how they can begin to understand and understand how genomics can actually help to prevent the development of either rare diseases, but more particularly of cancers. And personalised medicine is now becoming much more mainstream within the primary care system. So I'm going to stop there. Thank you.
Well, thank you very much to Patrick, Henrietta and Bernie.